Hello, welcome to From the Basement Up. My name is Michelle Brandress, and I am the founder of NameBubbles.com. Today's guest is Shayan Beg. Shayan is the founder of CurisNow.com, and he has created something, he's created a conduit for us, something that's going to help patients, doctors, and healthcare companies. As a patient, you're going to be able to find your doctor and compare pricing. It's encouraging people to take healthcare into their own hands, making it easy and accessible so it's not overwhelming. So I am just so excited for what he's done. This is in beta phase. It needs to launch ASAP. I can't wait till it's in my neighborhood. And Shayan, welcome so much. Thank you for joining us today on From the Basement Up.
Absolutely. Thank you for having me. It's an honor. So really started building upon this idea back in 2019, 2020, at the beginning of the pandemic. And it really stemmed from some frustration. So a little bit background, I moved to the US when I was 19 years old in 2010. And I was not familiar with the healthcare system, I didn't really, I'm young, I didn't really need healthcare, but I've always was used to the system of healthcare that I had back home, which is from Pakistan. And you don't really have a concept of health insurance. It's more so either you stick to government programs or you pay out of pocket cash and go get the service. And I thought I could do the same thing for myself here in the US as well, but I found a lot of red tape in being able to achieve that. And so I kind of manually went through the process, and I was like, all right, I'm a price sensitive shopper. I just needed something simple. I needed like dental cleaning, for example. And I said, okay, well, I could just go online. I'm sure there's a website where in the 21st century, 22nd century, and I could just find something, and nothing existed like that. And I got on Google Maps and got an Excel file together where I put things side by side, and I said, okay, well, I need this service, which is standard, and I could just find out pricing from 5 or 15 different providers within a 10-mile radius. And once I started building upon that, I saw that there was just massive amount of price discrepancy between the providers, as I called, for this one particular service. And it ranged all the way from $95 to $450 for the same service. And I was like, that's a wide gap. How are people able to get away with charging 95 and 450 for the same exact thing? And mind you, I did, there are people that might say, okay, well, maybe they're lower ratings, they're not as good. As a cutoff, I only pick providers that are 4.5 stars or more. Actually, sorry, 4 stars or more on Google Maps. So there was a bit of a quality assurance process, if you will. And that's really how the idea started. I said, well, this is a big gap, and there's an opportunity to make money whenever there's a huge gap like that. So, and ever since then, I've kind of built upon the project. Right now, we have a team of 5 people, 2 other co-founders, including myself, and then 2 developers, and we're in the process of hiring 2 more full stack developers in the next month or so.
So can you tell people about Curis Now? Like, I guess in the elevator pitch, when someone's asking you, what are you doing? What are you building? How do you describe it to people?
Excellent question. So Curis Now is a marketplace for healthcare services. So don't think of your insurance. Just think of, I need X. Can I pay X amount of dollars to get that X? Whether it be your X-rays, your MRIs, your dental cleanings, your annual physical, everything. It's pay per service models. There's no subscriptions, no nothing. You can just go on the platform, book your appointment right there on the platform, and pay a certain amount of fee for whatever that provider's charging.
Okay, my son actually just had a sports injury, and we need to get an MRI for him. So is this something that you would go into Curis Now? You'd say MRI, and then you would see what, like who's offering it, and does it link up your health insurance as well?
So that's exactly what my brother had. as well. He tore his ACL while playing soccer with me. But yes, once the platform is live, because there are certain pieces of it that are not live, you are able to see prices and compare them against different providers. So let's say an MRI should cost between $200 to $300. You should be able to see them, see it on the platform. Who's offering it? Where can I get it? Can I book it online? Et cetera, et cetera.
How did you come up with this? Okay, and so this is just me, because I think I look at healthcare and healthcare in this country.
Mhm.
It is so confusing. It is so difficult. It's
It is.
and you have to be the ultimate consumer. Like you just, and we don't think of ourselves as that. You know, we just tell, okay, doctor, what do I do? And then they tell us what to do. But I love how you're you started this. We need to be our own advocates and we need to be able to do this for ourselves. So when you started this, is this similar to like what a kayak.com does? Like when you, because that's kind of what I'm trying to relate it to something I know. Is that
Yeah.
what this is?
Yeah, I try to shy away from saying it's a kayak or a Groupon because I think
Sorry.
healthcare, we don't want to feel that we're getting a deal, right? We want to feel that we're getting quality attention.
Yes.
I'll go back to the example that your son had where he had a sports injury. And my brother, when he tore his ACL, his insurance wanted $1,200 out of pocket after they covered what they covered, right? And I told him, you can pay $300 cash and get the same thing done. So the gap in between that, now, of course, he changed health insurance and the other insurance covered 100% of it. Just navigating through that system is by design very, very cumbersome and difficult. So the average consumer ends up spending a lot more money than they would otherwise. Um, Another example that comes to mind is, I have I have health insurance, thankfully, thank God. But I said I'll run this experiment, right? So I'll drop my health insurance, just the dental, not the actual health insurance, and I will go on I will try and see if I can manually save more money by paying everything out of pocket versus what I would pay on an insurance plan, only for dental though.
Okay.
So last year was the first year I did that, and I spent a grand total of $150 in my dental cleanings. So I got 3 cleanings, paid cash for them, and I spent a total of 150 versus if I would have gotten health insurance or dental insurance, sorry, I keep using the wrong terminology. It would have costed me $450 just in insurance premiums. So I look at it as how much net benefit did I get out of the service? I would have spent 450 and the benefit would have been 150. So I was losing $300 on that, right? Now it's provided it's not a huge amount, but it could add up, right?
Oh,
This is only applicable to people who are, thankfully, thank God, I don't have a lot of cavities. I just need general maintenance. So for me, it makes financial sense to spend 150 and save the rest of it.
okay. So how does this work with, and there's so many questions because this is, a huge startup and I can see so much potential here. I mean, this is
Right.
awesome. And I'm just curious, how does it work with like the HIPAA laws and things like that? Because those are so complicated as well.
So in phase, the way we are incorporating it right now is we're not taking any information that would even put us near HIPAA.
Okay.
But the goal is eventually to get to a point where we build a data repository of your healthcare data, which we would house for free. So that way you are in our ecosystem and you can move freely to whoever provider you want, regardless of insurance, regardless of whatever, and you can just have your data available. A lot of times people stick to a particular doctor because, oh, I've been going to them for so long, they know me, whatever. If your data is in your hands, you
Yes.
can move wherever you want. And you go to your primary care physician, let's say, and they say, okay, well, you need to do, I don't know, you need to do an x-ray, right? You don't need to do it in their lab. You can go on once fully functional, you would be able to go on your app, you can book your appointment wherever the heck you want, and these features are going to be rolled out in pair over time, where we would be able to tell you exactly how much it's going to cost after insurance covers their part, or if you pay cash, what your cash price is going to be.
Okay. So what was your background and how did you come up with this idea?
My background is mechanical engineering.
Okay.
So I was nowhere even near healthcare in that regards. It was just uh, when somebody asks me, I oftentimes describe it as I'm a frustrated consumer.
Okay. Well, and you know what? That's what it takes. And
Yep.
you can tell that my nephew is a mechanical engineer and he always has to fix things. So
Yeah.
you can't help it. You're coming in, you're fixing this problem. So
That's
I think we're all going to appreciate that. So right now you're in your beta phase.
Mhm.
When do you see this going live?
So our timeline is to have a platform live in the next 6 months. Our development is 90% done, and we're working out the last 10% bugs and security issues. So it could be sooner, but we want to stay aggressive and make sure that we have a good product that we put out for the public. Because we really, at the end of the day, yes, coming up with a business is good, but we want to help the people and help them access affordable healthcare if they don't have the financial means necessary.
Okay. That's really cool. And is it starting like when you roll it out? Are you doing it in regions? Is it nationwide? How are you doing the launch of it?
So we're going to start with Chicago. And the reason for that is we want to be able to handle the bandwidth associated with putting something out there like that, right? So if you actually go on Groupon and look up dental cleaning, you could probably find dentists on there selling their services for very inexpensively. And Groupon also has this feature where you can see how many times it was purchased in the last month or so. So that also gives you a good idea of like, yeah, there's traffic, and it's mostly concentrated in bigger cities,
Okay.
but that's our plan, to roll it out in stages in cities so we have a good idea and we're building a better product for the next city over, let's say Detroit or Milwaukee or Indianapolis, which is the closest to us.
Okay. Now, did you get venture funding for this or did you have funding come in or are you bootstrapping this?
Bootstrapping all the way.
Okay. Bootstrapping is tough. I hear you. So are you also working another job in the meantime?
Yes, I'm a director of water hygiene and healthcare services,
Okay.
which is a confusing title, but don't. I work primarily with hospitals and managing their risk associated with some pathogens that are in water. Again, very niche, very detailed. Most people, when I tell them, they don't know what the hell I'm talking about.
Well, I love it's a hospital base, so I love it. So how has that transition been for you to suddenly, you're working for someone and now you can see yourself being your own boss? I guess my question is it scary or is it something that you're really looking forward to?
It's scary because I was just talking to one of my friends last night, and I said that bi-weekly or bi-monthly paycheck is very addictive. And the question I ask myself is, could I live a good life living on this paycheck? And yes, I could. Or I could do something extraordinary and change millions of lives and, make other people's lives exponentially better. And I would do it 100 times over if I could do things for other people, make their lives better, and not have to go through the same struggles. And again, it's not. I think what I went through is a very minuscule amount of struggle, but other people, because of finances and the lack of access to care, they struggle a lot, and eventually there's a lot of people that die and can't get the care or whatever. So I think that's really what excites me, is the impact I could have on lives and families and people across the country.
Well, absolutely. And I'm just thinking as a parent, just when you're so busy and, working mom or working parents, and then your children are sick and then needing to always balance things and find things. And it's just this will be so helpful for so many people and saving so much money. So
Mhm.
it's just, I love it. I can't wait till it's like rolled out. I'm on the East Coast, so I'm not going to be able to see it. I can't wait till it gets rolled out over here. But I'm just curious, how do you get all the information and put it into the database? Like I feel like there's so many dentist office. There's so many, there's so many places to get MRIs or X-rays or how does this even happen? How do you even start?
That was a very daunting task for us too. When we started to think about it, we are like, oh my God, there are hundreds of thousands of providers. How do we get all their data? Is there a central repository or whatever? So there are, lucky for us, we try to work smart, not hard.
Good.
And there is a API that we found, which has kind of a repository of all these, it scrapes the data online and it comes up with the information like their addresses, their emails, everything. So we try to automate as much as possible. So once the platform goes live, right now we're in beta, we're testing it out with some people. Once the platform goes live, we're going to be able to send an e-blast to all of them saying their profile and data already exists in our program, right? So we have their addresses, phone numbers, emails, everything. And it will prompt them to sign up on our platform with all the information already in there, most of the information that's publicly available. And that way we automate the process rather than having human beings call them and verify information and sell to them and whatnot. And then once we have that and we have few people that might not sign up for whatever reason, then we will move them into a second pool where our team is going to start manually calling them and saying, hey, we sent you an email, this is our platform. Do you have any reservations? And I'm assuming some people will. But that's our process in having large amounts of data being imported into our system.
Such a good idea. Now, did you do any focus groups with doctors' offices or dentist offices just to kind of hear their feedback?
Yes, we did. And one of the feedbacks that we got from, and this is particularly very interesting, these doctors could sometimes wait between 30 to 60 days to get paid from the insurance companies, depending on the insurance provider, right? And I'm just using this one particular example. And that's frustrating, right? Because time value of money goes significantly down. I said, no problem. We can get you paid the day you deliver the service. The next day, it'll be in your bank account because
What?
we have the cash on hand, right? Because we are taking the money upfront from the consumer and holding it until the service is executed. So now you go from having 60 days or 30 days, depending on, you go through your billing cycles, your medical biller bills the insurance company, and then they might have reservations. I'm like, you're going to have zero claims. Nobody's going to say, okay, well, submit this document and then we'll accept the payment or whatever. Once you do the service, we have some quality checks to make sure they actually did the service and not just requesting the money. You will have the money the next day.
Okay, now this is something I had not thought of. I'm kind of blown away here. So let me just process this a little bit. If I was GoodRx or if I was like Empire Blue Cross Blue Shield, I would come and be buying you already. Have you had that start yet? Have people started approaching you to buy you?
I assumed that would happen. I hate insurance companies. I will publicly say that. I don't think anyone's a fan of them because they deny people that really need care access, right? And I've had to do this a lot on my parents' side where, it would be something that they absolutely need. The doctor recommended it and they would be like, we're not covering it.
Yeah.
And I would be very, very, very hesitant. I don't care what the number is. I would not be willing to sell it to them because I think this is a public good that needs to happen.
Oh, good for you. Thank you. So it's just so great to hear that. The insurance side of so for example, my dentist
Mhm.
recently just dropped insurance. So, he doesn't take insurance and that just happened. And I've been going to him for 20 years. I'm like, wait, what's going on? So, I mean, this will potentially stop that from happening. Okay, and it's because he's had is such a hassle dealing with insurance companies. So
Yep,
this is amazing. Doctors must be so excited about this.
they are. And they're like, well, we don't have to file claims or do any sorts. I'm like, dude, you just worry about taking care of your patients. Let us worry about the money side. You know, the service that they come in for, we'll get them built. We'll bill them up front. Obviously, they're paying cash, right? And we'll get you paid the next day once your service is rendered.
So is that piece of it launching when you launch beta in Chicago?
Mhm.
So has so sorry, just hear me out here. How has the city approached you about this? Because I can imagine it's just to be able to get it out to everybody. I mean, this is just a huge help. I mean,
Yes.
so I'm just wondering if you see this like being approached by like a state government or, even for their state employees, things like that. I mean, how do you make money?
So that's an excellent question. So every time there's a transaction on our system, we charge a certain percentage of that transaction for facilitating and it's transparent, right? We tell the customer if they're paying $100, let's say 15 or 20 bucks is making it into our pocket, and then there's a certain amount of processing fee that we have to pay credit card companies and whatnot. So we break it down for them just so we're 100% transparent and they know exactly what we're making, what the doctor's making, and there's complete transparency. At the end of the day, as much as I would love to help people for free, I have to maintain a business. There's no incentive to do it otherwise. We want to make sure we're delivering quality product and that we are able to continually help more and more people and build better and better products to achieve that goal.
Well, I love that you're allowing people to look at the program, to do the searching, to check it out, and they're saving money. And it's a great way for them to be able to use this product and pay for it. So it's definitely worth it. Absolutely.
Yeah.
That is fantastic. So when do you see the rollout happening?
So, as I said, I think 6 months. So that would probably put us in July. I think we had a soft date of like 15th of July for the rollout. That's of course with development stuff. We've had a lot of development hurdles, to pull it mildly, and we're hoping that it could be done a lot sooner, but we want to give ourselves enough time so that if and when things do come up, we have enough ample amount of time to be able to address them promptly and swiftly.
Wow. Wow. So I'm just curious, when you were thinking through this, did you have a whiteboard? Like, were you just laying in bed coming up with this idea? How did this all percolate? Because there's a lot here.
Most of my good ideas come in the shower, and I'm one of those people, and the reason I took this to the level I have right now. And sometimes people think I'm BSing this, but back in 2010, 2011, when I first came to the US, I got to know these smartphones, and I mean, I didn't have a smartphone back then. I think I got my first one in 2010. Before that, I had a Motorola Razr, which everyone was crazy about.
Yeah.
And I was like, oh my God, this thing is wild. Like, you could do so much in the palm of your hands. And I thought of an idea which would translate roughly into, Uber or Lyft, something like that, right? And this is 2010. And I have my notes that are dated from that time to prove it when anyone says that no, you didn't. And I was like, look, I came up with this idea. I wrote down all the government subsidies that you could do, a lot of the things that Uber and Lyft are doing today. And I always beat myself. I was like, why didn't I do anything about it? I could have failed. That 99% chance that I could have failed, but at least I didn't even try to fail. Right. So then I told myself, if I have an idea that sticks and that I think has value, I'm going to pursue it as far as I can. And if I fail the process, that's okay. At least I gave it a shot. So,
Yes.
um,
Well, I mean, just the fact that you're coming here, seeing how bad and it's just antiquated or just dysfunctional our healthcare system, and then coming up with a solution is amazing. And it just, I have said this for a long time. It's, as I'm getting older, my mom's getting older. It's scary. It is scary. And I feel like as we get older, it's almost like, we don't want to be left behind. We want to be able to how do I even handle this? There's so many new pieces. So my husband has heart issues. I have my own issues. So how it's just staying on top of it all. It's very scary.
It-
So how you're coming about with, the long range,
Mhm.
I'm loving that. Even the short range, even the short goals are fantastic. So, because I do go to the same doctors that just because they have all your files.
Yep.
And it's easy and it's convenient. So, and it's great if you could have that repository where all of your stuff is up there for you to go in and bring when you want to see someone.
Yep.
So, it's just such a great idea. I love this. So when you're pitching this idea to people, what are you hearing back?
So, and by the way, I do want to. I know I told you I'm bootstrapping, but I have pitched to VCs, and the biggest hurdle I tend to come across when I pitch to VCs, and they're like, "Okay, well, how many consumers do you have on your platform, right?" And I'm like, "Look, I am doing this for. There is a certain aspect of profit in mind, but at the same time, my intention is helping people." And I never want to lose sight of that goal. I never want to let an exuberant amount of money let me lose sight of that goal. So a lot of times I don't think unless people are lying to my face, which is very possible. But I have not heard negative feedback in the sense that, oh well, this is going to suck. Like nobody's going to use it or whatever. They'll have like minor instances of like how I can do approach it a little bit differently. And one of the ideas was that, we talked about data in the last piece that you talked about, right? So right now we're in the age of data and that data is valuable, right? So there's actually a company out of California that started doing this where you can warehouse your data for a subsidized cost, provided you share that data with researchers if you fit the category of people, right? Now, you might not be comfortable with that, and that's okay, right? But I said, well, there might be people. I'm okay with a researcher getting my data as long as it's anonymous and they can,
Exactly. That's what I
yeah,
was going to say.
as long as it's anonymous and they can look at my health record and use it for betterment of humans, across the globe, that's okay with me. But now, what does that mean for you as a consumer? Am I getting any benefit out of it? So once we have that portion, and this is going phase 2 or 3, so I'm jumping ahead, but we want to be able to use that data, sell it to companies that might use it for research, and then actually give money back to the consumer in terms of subsidized cost and say, hey, we will actually pay you to go get an annual physical because you fit the category of people that this research is looking for. So then once we have that user base and vertical, we have multiple avenues of making money and not just like, oh, well, we're just a marketplace.
Okay. So what if, and I'm just putting this out there, what if like the federal government heard about this idea and they're like, wow, this really sounds amazing. And they put some money in or help fund it. Is that the route you want to go, or would you want to stay private?
Um, I would gladly accept federal money because I think and it's no secret. One of my friends who's been doing startups for a lot longer than I have, he's like, dude, that exponential growth that you get initially, that will drive you insane in a good way. To stay motivated, to stay on top of your goals and things like that. So he said, dude, consider like trying to pitch harder than you have been in the past, because then you can do a lot more in a lot less time. So government, I'm okay with if there's government grants. We have, applied for a few government grants in the past. We unfortunately didn't get it, but that's okay. I don't think that the past defines the future. So
Okay. So just because we're kind of coming to the end of our time together, and what I love also having people share is just kind of like the biggest, I guess, wins, like your biggest win, and then also what was your biggest mistake?
my biggest win. So when I got my co-founders and when I hit that 5 number, that was a win for me. Because that just again they work with me, so I think that's my biggest asset right now. I think I value them a lot because somebody other than my family, which could just be nice, validated the idea and believes in it so much that day in and day out, they get on calls every, week, they get things done. That's my biggest asset is my team that share the same vision as myself. And then my biggest loss was, back in 2020, 2021, I had the platform almost complete, until, we had some disagreement between the co-founders and the person completely wiped off my platform. So I started from literally scratch to build this whole thing again in the last year and a half.
Oh,
So yeah, that was my biggest learning lesson.
heartbreak.
Yeah.
So what would you advise? What things have you put in place so that never happens again?
So I didn't even know what a repository was before this. So I have a repository which is only accessible by me, and a few other people, but you have multiple backups. So even if you erase one, you have another one and another one, and I'm the only master one that can access it. And I can revert back at any time. So I have masters to everything now myself. I don't give it to anybody.
Yes.
Still, eventually I will have to give it to somebody as you grow and scale. I can't be the only one looking at this, but I think that's a problem for later.
Yeah, I mean, and that is a good problem when you get to that point, and then you still have your backup. So,
Yes.
so you're fine.
Yeah.
So words to live by, and I love how you're doing this for the good of mankind and for all of us. So I'm sure you're going to have some great words to live by. But do you have a mantra or like a saying that you have for yourself?
Only one word: persistence.
Okay, that's good.
Yes.
I'm just I'm still getting my mind around everything that you've told me. And I'm sitting here just going, that would be so amazing. It would be so amazing. It really would. I mean, it's almost like you become we're good shoppers. We're good shoppers in this country, and you're able to shop for your care, and that would be an amazing thing. So it's like you have more control, and then it's not as scary. And
Mhm.
I think that's the other thing. It's like, those price tags are really scary. You don't even want to go to the doctor because you don't want to know what's wrong, because it's going to cost a fortune. So
Yep.
having that ability to I guess mitigate that is just so helpful. So
Yeah. And the average person in the US spends around $10,000 annually. So that's a significant chunk of money. Um,
absolutely. Is that by person or by family?
I think it's by person. I'm forgetting the statistic completely. It's in my pitch. I should know, but I haven't pitched in a few months. Yeah, but I think it's per person.
Oh, it's crazy. It really is. So, but for people to find you and to find what you have right now, where can they go and where would you send them?
So there is a link on our website. So if you go CurisNow.com, you are able to sign up for access. So we keep a repository of all those emails that have signed up, and we're going to send an e-blast out once we're ready to sign up. You can follow us on LinkedIn. We're on Instagram, Facebook, all the social medias. You can connect directly with me. I'm on LinkedIn. And if you search Curis, I think there's only like 4 or 5 people that come up. I don't know how some people by mistake put that as their job, but feel free to connect with us. We'd love to.
Yes, absolutely. And one quick thing. I live in a little bubble. I live in a small town. So when my girlfriend was in Seattle and Uber was coming out, I'm like, oh, I'll rent a car. She goes, no, get an Uber. I'm like, what's an Uber? Like, what are you talking about? So how long will it take till this software gets to small towns versus a big city?
Um, so I think I can project that in the next 5 years, most likely we would cover small areas. And the problem with smaller towns is really the supply versus the demand, right? You probably, depending on the size of your town, you only have a few providers, and they might be reluctant to get on a platform where they already might have, they're like, we're happy with the business we have. We don't really need to compete with a lot of people. We're good. But in bigger cities, competition is fierce. So you get a lot quicker signups and traction in big cities. So, but I hope we're going to try to aggressively also market to smaller towns, because that's where people spend a large chunk of their income on healthcare, and that's where the gap is wider in terms of care. So they might have to drive a little bit far out. You can still access the platform, but you might have to drive a little bit farther to get that care. So whether that's okay with you or not, it's up for you to decide, but you would still be able to get some sort of access to the platform.
But I just think overall it's going to be great just for doctors not to have to deal with health insurance, and they're going to be they're going to be on board. They're going to love this.
Yep, the ones we've talked to are, and we're hoping the wider medicine community is going to be on board too, minus insurance companies. They might not like us.
But they might, because it's like one person that they have to work with versus a bunch of different doctors' offices. So it might be very helpful.
Yeah, and I do crap on insurance companies because I don't like them, but I think it's a win-win for them as well, where if they are able to they're like, okay, well, this person spent this much, let's just reimburse. And if their person that they're insuring is being price conscious, ultimately it saves the insurance company more money.
Mhm.
Because then they don't, from a long-term care standpoint, we know that prevention is better than cure. So if you have healthier people, they're going to require less healthcare in the long run versus the short term.
Absolutely. I totally agree. I think it's a win-win for everyone. It
Mhm,
really is. It's fantastic. Okay, so for the listeners, Curis Now.
mhm.
So go online, visit, check it out. I think it's going to be happening. I think you're going to get noticed by someone, and it just expands. It just grows really fast. At least that's what
Thank
I'm
you.
hoping for.
Thank you.
So Shayan Beg, thank you so much for joining us today. I really
Thank you
do.
for having me.
Absolutely. Have a great day.
You too. Thank you.
Thank you to our listeners for joining us for today's episode. And thank you to my amazing producer, Emily Flanagan. She deals with all my shenanigans. Julia Augustino, thank you for the amazing composition that you have made for the podcast. And listeners, feel free to check us out on our social media channels. Don't forget to give us a 5-star review. And you can also visit us on FromTheBasementUp.com. Thank you so much.